When people hear the word lithium, they usually think bipolar disorder, hospitalization, zombie toxicity, scary side effects. But honestly, low-dose lithium is one of the most fascinating tools in psychiatry because sometimes tiny doses can make people feel less reactive, less irritable, more resilient, more emotionally steady, and more like themselves again. One of the reasons I find it so fascinating is that patients rarely tell me it made me feel happier. They tell me something very different. They tell me I feel sturdier. That's a completely different thing. And often they don't realize how dysregulated they were until things finally calmed down. I'm Allison, a psychiatric nurse practitioner in the Woodlands, Texas, and today I want to explain why low-dose lithium is completely different than what most people think. What is lithium? First, lithium is not some synthetic designer chemical invented in a laboratory. It's literally an element on the periodic table, a naturally occurring mineral God made. Tiny amounts occur naturally in groundwater in some regions, and one of the most interesting things in psychiatry is that some population studies have found lower suicide rates in areas with naturally higher trace lithium in the drinking water. Does that mean everyone should run out and start taking lithium? Of course not, but it's fascinating. Lithium has been helping human nervous systems long before pharmaceuticals ever existed. The biggest misunderstanding and the biggest misconception is that lithium only works at high doses. Not true. In psychiatry, we have what we call therapeutic blood levels for classic bipolar treatment. Those are higher levels providers monitor carefully. But clinically, many providers notice meaningful improvement at a much lower level. I see it all the time. 150 milligrams or 300 milligrams, sometimes a surprisingly small amount creates a surprisingly meaningful shift. That's one reason low-dose lithium continues to fascinate me. What people report? Patients on low-dose lithium often describe things like, I don't spiral as hard, I'm less reactive, I don't lose my entire day to one bad moment, my brain feels quieter. That really worked. I still have emotions, but they don't consume me. Some people notice better sleep. Some notice less irritability. Some notice improved mood, better stress tolerance. And some describe feeling emotionally sturdier. And honestly, that's one of my favorite words, sturdier. Not numb, not sedated, not emotionally flattened. Sturdier. Now let's get nerdy because this is one of my favorite things about psychiatry. Brain-Derived Neurotrophic factor. If you've watched my videos before, you know I love talking about BDNF. Think of BDNF as the fertilizer for the brain. It supports neuroplasticity, adaptation, resilience, healthy neural connections, learning, recovery, and the brain's ability to change. It helps chronic stress, trauma, depression, inflammation, poor sleep, and chronic illness. These can all take a toll on the nervous system. BDNF is one of the reasons researchers became interested in interventions that may help brain repair and help it adapt and become more resilient. Lithium appears to support neuroprotective pathways and neuroplasticity in ways that continue to fascinate neuroscientists. That's one reason I don't think about lithium as a mood stabilizer. I think about it as brain health. Let's talk about brain inflammation and nervous system stress. Another reason I love low-dose lithium is brain inflammation. Now, inflammation gets thrown around way too much online. Not every symptom is inflammation, but we know poor sleep, chronic stress, blood sugar instability, trauma, metabolic dysfunction, and elevated stress hormones affect the nervous system. Some patients describe low-dose lithium almost like the brain feels less inflamed, less raw, less reactive, less fragile. Again, not magic, not for everybody, but I've absolutely seen people noticeably more stable. Let's talk about dementia and brain aging. Neuroprotection. Another area that fascinates me is the growing conversation around lithium and neurodegenerative disease. Researchers continue exploring whether lithium may have protective effects related to cognitive decline and dementia. This dose does not mean lithium cures dementia. It doesn't. But the neuroprotection conversation is real. And it's one reason many neuroscience researchers continue studying lithium decades after its introduction. So why do I prefer low doses to high doses? High-dose lithium absolutely has an important place in psychiatry, especially with severe bipolar disorder and suicidality. But personally, I use low-dose lithium much more often. Why? Because side effects are usually dramatically lower. Many patients tolerate it extremely well. Occasionally, I see mild nausea, increased thirst, or a tremor. Sometimes we start even lower than 300 milligrams. Sometimes 150 milligrams is enough. And honestly, I've seen people do beautifully there. One thing I really appreciate clinically is that low-dose lithium can sometimes reduce the need to keep increasing the dose of antidepressants. Instead of chasing symptoms upward with more serotonin, sometimes stabilizing the nervous system works better, especially treatment-resistant depression, mood reactivity, irritability, emotional instability, the person saying, the antidepressant helps for a while and then I crash again. Lithium augmentation has been around in psychiatry for a long time for a reason. Sometimes the answer isn't more antidepressant. It's FDA approved for add-on to an antidepressant. Sometimes we just need a different strategy. If you followed my channel for any length of time, you know I am obsessed with sleep. Because when sleep improves, everything improves. Emotional regulation, focus, pain tolerance, irritability, stress tolerance, mental clarity. Some patients on low-dose lithium sleep deeper. It's more restorative sleep, not necessarily sedation, more like the nervous system settles. And when the nervous system settles, life often becomes easier. Why is it so stigmatized? Honestly, lithium has been a branding problem. The word scares people. Historically, people associate lithium with severe illness, hospitalization, toxicity, flat affect, and scary side effects. But low-dose lithium conversations are very different than high-dose acute mania. It's a completely different context and a completely different risk-benefit discussion. Fun historical fact, lithium was actually included in the original formulation of 7-Up decades ago. People joked that it improved mood. Eventually, it was removed medically. That was some giant conspiracy? No. Lithium absolutely can become dangerous at inappropriate levels. Monitoring matters. Medicine matters. But it's fascinating how differently society views substances once they become pharmaceuticalized. Now, for the responsible section, lithium is still a real medication. Even at low doses, providers can make sure the kidney function, thyroid function, hydration status, medication interactions, and certain medications and medical conditions are watched over, especially if someone's taking NSAIDs, has kidney disease, becomes dehydrated easily, or takes certain blood pressure medications. Never randomly combine supplements and medications without talking to your provider. These are not prescriptions, just patterns I think about clinically. People who tell me, I'm emotionally fragile, I overreact to everything, my antidepressant only partially helps, I'm exhausted from mood swings, I crash under stress, I'm not fully bipolar, but my moods definitely aren't stable. Or people with treatment-resistant depression, whose nervous system simply feels stuck. These are the people I think of. One thing I've learned after being in psychiatry is that people don't usually come looking for emotional perfection. They come because they're suffering, they're exhausted, they're irritable, losing relationships. They're tired of feeling fragile. When low-dose lithium works, people rarely tell me they feel drugged. They rarely tell me they feel numb. They tell me they feel solid again. And honestly, Sometimes that's one of the most meaningful outcomes we can hope for. If you've taken low-dose lithium, I want to hear from you. What changed first? Sleep, mood, irritability, anxiety, emotional resilience? Did you feel sturdier, or did nothing change at all? Put your dose in too. Tell us how long you took it. Tell us what improved. I read the comments, and so do people trying to decide whether treatment is right for them. Your experience may help somebody feel less alone. And if you enjoy discussions about psychopharmacology, neuroscience, depression, ADHD, anxiety, trauma, supplements, brain health, and integrative psychiatry, subscribe. I'd love to have you here. Sometimes the most powerful treatments in psychiatry are not the loudest ones. They're the ones that quietly help the brain become more resilient over time.